those essential workers, the people he pretends to care about, the little guy needs paid sick days.
Ontario keeps breaking COVID-19 records. All this week, we broke our own record for new COVID-19 cases with over 4,000 new cases a couple of times. And it just keeps getting worse. Now, a major part of the problem has been Ontario Premier Doug Ford, who's failed us in a variety of ways. One of those ways has been a lack of paid sick days. So if you're an essential worker and you're feeling kind of sick, you might have COVID-19, you still go to work, give everyone else COVID-19, come home, have it yourself. It gets worse, and it's never properly dealt with. Frontline workers, essential workers, have not been the focus of the vaccinations in this province, and that's been part of the issue. But lack of paid sick days has been another major issue, and NDP leader Andrea Horwath questioned Doug Ford about this. And as you'll see from the pop-ups in the video, Doug Ford lied his way through this answer.
Every single expert has been telling this Premier that those frontline heroes, those essential workers, the people he pretends to care about, the little guy needs paid sick days.
And the negative talk that comes out of the leader of the opposition, again, does a disservice to all of the frontline healthcare heroes, no matter if it's Dr. Williams or Dr. Brown and the 100 doctors underneath them, or if it's Dr. Davila or Dr. Lowe, that all are giving advice, all working their back off.
So as you see from that video, and thanks to James Waddy here from CBC for putting this together, all those headlines that popped up, if I can give you a closer look, they're all of the doctors he's mentioning that are actually in support of paid sick days, claiming that they don't support it. Obviously, paid sick days would help to limit the spread of COVID-19. Do I really have to explain this again? If you feel sick, you get to stay home and still be able to make money to live. So if you have COVID-19, stay home and don't risk spreading it to other people, especially if you're working in a public setting. But if you're an essential worker and you have to rely on that paycheck to live, and you simply are, worried that if you take a day off, you're going to lose pay, maybe lose your job, it becomes a serious issue. Paid sick days, definitely a major piece of this. I'm going to have another video coming up in a second here, but I also want to discuss the other issues at hand here when it comes to the vaccine rollout, or the pandemic in general. Yes, Justin Trudeau and the Liberals, as I've covered a number of times, of course, there's a lot of blame to go on Trudeau and the Liberals. I got an email last week from somebody complaining to me that I criticize Doug Ford, but I don't criticize Justin Trudeau. If you go through my videos, just go to the channel, go to the search bar in the channel and type in Trudeau. You will see all my videos on Justin Trudeau throughout this pandemic and even before that. And I'm not sure there's one positive video about Justin Trudeau. I've had a lot of criticisms of Justin Trudeau, but you can't simply ignore the role of the Premier of Ontario and the role of premiers in general across Canada and their responsibility in rolling out the vaccine. We still are not focusing on essential frontline workers. They're the ones that are spreading the virus around through no fault of their own. They're people that have to go to work. They are public-facing positions, or people working in factories with 300 people. These are the people that you should be prioritizing when you're vaccinating. But we have not done that, and the new variants that have popped up are right now dominating the cases in Canada and are leading to this massive increase in infections because they are so much more transmissible than the original COVID-19. Now, one more video here. So this is Dr. Callie Barrett basically explaining the situation in Ontario.
What you described sounds like a war.
I really can't think of a better analogy. And the really tragic thing is that those in the line of fire are the people who are most vulnerable in our society. So right now, the people getting sick with COVID-19 are not the wealthy people who can work from home who are probably getting vaccinated. The people who are getting sick with COVID-19 are the people who have no choice but to leave their house and expose themselves to the virus at work. And they may or may not have been vaccinated, and they may or may not have the agency and the social capital while they go to work to speak up if they're in an unsafe environment. And when they do get sick, they're probably going home to a very crowded household with multi-generations living in the same building or household. And if they do get sick, the likelihood that they're going to infect everyone that they live with is very high. I took care of a patient this week in the hospital who had COVID-19 and was desperate to leave against medical advice while he was on 100% oxygen because his wife, his wife's mother, and his 6-year-old child all had COVID at home. And he was freaking out that his wife couldn't handle looking after everyone in his family. Entire families are getting sick with this. And it is affecting the most vulnerable in our society. It is infecting those with the least social capital to be able to speak up for themselves, those with the least amount of representation right now in cabinet and in government. And it's completely unmasked the inequities in our society. And I'm angry, and I'm sure you can see the anger in my voice. Yep. It is not the way I ever expected things to happen in this country.
We are simply not focusing the vaccination rollout on the people that need it most. There is a long way to go before Ontario and Canada in general is out of this.